Dr. Reyes here, the tubbydoc. I want to talk to you, what is primary care and what are the different specialties that can do it? Primary care is basically when you Google or AI search it, is going to be the first place that you go get your care. And unfortunately, a lot of you who are in your 20s or 30s, you may get all your care at urgent care. So our specialties that are in primary care, OB-GYN for our women, right? Family medicine, internal medicine, and pediatrics. That's really the four places of primary care where patients will go get long-term care, not just urgent care or ER care. The ER physicians, they do not like to be considered primary care, and sometimes they do feel like that whenever patients keep coming back to the ER because they're not designed, they're not trained to think about the long-term treatment for patients. That's what I'm designed for. That's what internal medicine is designed for. So let's talk about what's the difference between each of those specialties. OB-GYN, pretty obvious, right? That's for women's care. Pediatrics, so those are for usually 18 and younger. Some of the pediatricians will continue to see you all the way through the young 20s, but you kind of graduate out right when you hit 18. For internal medicine, we usually start saying that we take over around 18, but the truth is, for our purposes, we can actually probably see 12 and up from a biological standpoint and from a medicine standpoint. Age 12 and up is probably when we can start taking over, but I tend to err on the side of 18 unless I'm treating pediatric unhealthy weight. So if the kids have unhealthy weight, I have lowered my age down to 12 to help with kids who have unhealthy weight in the Dallas-Fort Worth area. Family medicine, they are trained with a wide range, all the way from babies all the way to the elderly. So me, as I'm internal medicine, as an internal medicine primary care physician, what makes us unique? We're the experts at those chronic diseases such as diabetes, hypertension, high cholesterol. If you've had a heart attack, if you've had a stroke, you probably should be under the care of an internal medicine physician at that point. Because here's the truth, cardiology will only take care of the cardiology meds. You need someone to bring that all together and look at all those meds together instead of isolation. And that's what internal medicine, that's what we're the experts at, to tell the truth. And a lot of times we will stop you from seeing those, or not stop, but you don't need to see those cardiologists or that nephrologist as frequently because you have an internist on board. What about women? When should women transition from having a primary care OB-GYN to internal medicine or family medicine? I would say probably maybe in the 30s or 40s. Definitely is a good time if you start developing chronic diseases that you need to start finding a medicine primary care doctor, especially if you have a major event at a young year. I define young as below 50. Maybe I'm a little bit biased because that's where my age is at right now. But if you had a stroke, heart attack, you have a chronic disease, probably need to move away or add into your healthcare team a medicine primary care, an internal medicine doctor, or a family medicine doctor. I hope that helps clarify the role of primary care. We're your long-term physicians. We're going to watch you over time. I talked about all the specialties in this video. Go back and watch it if you need additional information or if you're new to the healthcare system. I'll see you at the next video. Tubbydoc out.